Partnered by Time's influence.
Good morning, Dr. Varun.
Good morning, Dr. Sahani. Shall we?
Yeah.
So how long have you been working here?
Well, not long enough, but good enough to call it an experience.
I hope it's been a good experience, because personally, I feel there is nothing better than being able to save a life.
True. I wish we could save all the lives.
You know, I'll take this silence over anything, any day.
Don't count on it. You know it never lasts.
I know. Let me just savor it while it still does.
Doctor! Doctor!
What happened?
I don't know. What happened? I really have no idea.
Okay, sir, please stay here.
I need to see her. She's my wife.
Sir, please. What happened?
45 minutes ago, she was absolutely normal. I mean, 46 minutes ago.
Okay, don't panic. We'll find her out. Just stay here and let us do our job, okay? Dr. Suma?
The patient is looking pale. Peripheries are cold.
Doctor, I can barely feel the pulse.
The BP is hardly recordable.
There is no visible trauma, nor has any been reported by the husband. So why is the BP dropping?
Sister, secure 2 18G lines, start fluid, check O2 saturations, connect to monitor. What do you suspect?
Could it be blood loss?
History.
We need history.
It's okay, it's going to be okay. Relax. Sister, we can't shift the patient, so we need the bedside sonography machine.
Okay, doctor.
Fast.
Has she ever experienced this kind of pain before?
No,
Is there any other medical complication that we should know about?
not at all.
So do you guys have kids?
We just got married, in fact, 6 months ago.
Okay.
We don't want kids right now. But so how is this relevant right now?
See, there could be a lot of things that could be happening. And
Doctor, what happened?
so we are trying to figure it out. Just give us some time. Just stay put. I'll come back with more updates, okay? Yeah.
Oh God, there's blood in her pelvis. Sister, do one thing. Take a blood sample and send for an emergency cross-match. Also send a coagulation profile, urgent urine pregnancy test and start transfusion of 2 units packed cells. Got it.
Dr. Sima, what is it?
Dr. Varun, there's blood in her pelvis.
Sister, keep rushing fluids.
I'll go book the OT.
Yes. Call Dr. Harshita. We need a gynae consult.
Yes, Deepak, I'm listening. Don't worry, I'll be there on time. Yeah. Deepak, I'm really tired. I just finished a C-section and I have to eat something. Otherwise, I'll faint before the next operation. Okay, bye. Bye.
So how was the operation, Dr. Harshita?
Thank God they brought the patient on time. It was a pre-eclampsia case. And the blood pressure was high enough to turn it into eclampsia. And that would have been a disaster.
Disaster? Yeah. Not when you are there.
Handling eclampsia has always been a nightmare for any gynec. Yes, I've done that before. And I was lucky enough not to have lost the baby or the patient.
You know, I have always been curious as to why this eclampsia happens in the first place.
The real reasons are still not known, but it's mostly related to pregnancy only. And you know what? Most of the women in India, they don't even go for proper checkups during the pregnancy. Otherwise, it's not that easy to diagnose it at pre-eclampsia early phase. And at this phase, it can be easily treated with medications.
Right.
You know, what disturbs a doctor the most is that when a situation or a condition can be easily avoided, because of ignorance, it's still happening again and again. It's so disturbing.
One patient at a time, Dr. Harshita. One patient at a time. Today you tell them about the importance of regular checkups in pregnancy. Tomorrow they will tell it to their relatives.
Actually, you're right. I never thought of it that way. And I'm making a difference also. One patient at a time.
That's the spirit.
It's from the ER. Yeah? Okay, I'm coming.
Slowly.
Not when you have a call from the ER. See you. Yes, Dr. Sim.
File, please.
Did you ever take any measures?
Pragya, don't worry. Whatever you say will stay here with us. But you need to tell us the truth now, okay? Please, trust us.
Doctor, my parents had me after a long gap. My elder brother, he's 17 years older than me. I had always felt that my parents are in the age group of the grandparents of my friends.
But you don't owe an explanation to anybody. You understand that, right?
But I owe an explanation to my husband. Praveen was always worried about the financial implications of having a child. But I always thought that having a child would help us to bond with them. Yes, I had stopped taking the pills.
Dr. Harshita?
Oh, yes. I can understand, Pragya. Sima, we need to take the UPT. I think it's an ectopic. We have to inform the OT.
But I've already done that.
Okay, but we need to take her husband's permission.
It means she was not taking her pills.
Mr. Praveen, even the pills are not 100% safe. There's 2-3% chances that even after taking the contraceptive pills, one can get pregnant.
So?
So, this is probably an ectopic pregnancy, which is pregnancy outside the womb. There's a lot of damage to one of the fallopian tubes, and there's a lot of internal bleeding as well. So, to save her, we need to operate her. And as there's problem in one of the fallopian tubes, there are chances that face problems in getting pregnant later. Mr. Praveen, please be optimistic. Right now, we need to focus on saving her life. And for that, we need to rush her to an OT right now. Yeah, Deepak, I know, but you should also understand. This is an emergency. I'll be there when I finish the surgery. Talk to you later, bye.
Everything all right, doctor?
Yeah, just in-laws anniversary.
Just their anniversary, as in? I mean, isn't that supposed to be a big deal?
Yeah, but when I compare it to the situations I face here, I feel it's something we can manage.
Can I tell you something if you don't mind?
Yeah?
I feel that at times when we ignore our loved ones for way too long, we can actually lose them.
I didn't follow you.
Nothing. Let's get to it.
There's a lot of hemoperitoneum. Sister, maintain the suction. All okay on your side? I can still see a lot of active bleeding. I need a little more time.
Sure, doctor. Sister, please immediately get 2 PRBC, 2 FFP, and 2 RDP.
Let's go for self-ingotomy. Let's preserve the tubes.
Doctor, is she?
Yes, she's fine.
Doctor,
Yes?
one more thing. Does ectopic pregnancy result from contraceptives?
Yes, in some cases. But don't worry, you'll have kids in future. But you should probably be with your wife right now. You can speak to her once she's completely stable and awake. She has bled a lot and she might be groggy after the surgery.
Human body is quite complex, and the female body is even more complex. It has the power to give birth to a new life. Now, at times it feels like that maybe we're not ready, or this is not the perfect time. But sometimes we just have to let the body do its work, which is in sync with the soul's emotions. And right now, the best thing would be to take care of your wife's emotions. Take care of yourself.
We'll get back. Thanks, bye.
Hey,
Hi.
so I heard you guys did a good job today.
Well, actually, Dr. Harshita and her correct diagnosis deserve the credit for that, so.
So, how about coffee on that note?
I actually need a coffee. Can we?
Sure.
Thanks. Been a tiring day, no?
So how is Pragya doing? She's a very strong woman.
Yeah, she's fine now. But I just hope that her husband believes her.
Yeah, it's very important for your family to understand you.
What?
Well, my dad is a businessman, and ours is a big Punjabi family. I'm actually the first person from my family to do a job. Me and my dad, we don't exactly live in the same house. We hardly connect.
So he's mad at you for not carrying his family legacy.
It's not like that. I mean, it's not like I've given up on the family surname. Dr. Simarai,
Dr. Varun, sometimes the situations can vary. Anyway, I have work in the ER. I'll see you later.
I didn't...
Praveen. If I would have taken contraceptives, all these would have been avoided.
Not necessarily. Doctor told me it could have happened with that also.
If I could never ever conceive, that's fine. You never wanted children anyway.
I would if you would. As of now, I just want to focus on this crazy smart kid of mine.
How are you feeling now?
Better.
Good.
Doctor,
Yeah?
may I ask you something? How many children do you have?
I don't know if at this stage of my career I could afford to have kids or not.
What? You don't have children when you can have them. And
Actually, I came to give you good news. With God's grace, your ovaries are fine. There's only a slight problem in one of your fallopian tubes. But you will be a mother for sure. If not easily, but with right treatment, we'll make sure of that.
We strive so hard for perfection that we forget that imperfection is happiness. Even imperfection itself may have its ideal or perfect state.
Good evening, Dr. Sumit.
Good evening.
Busy day, huh?
Yeah, looks like yours too.
Lots of missed calls from home.
Even my son is waiting for me.
You know, sometimes I feel as if we take our families for granted.
Well, a doctor's first priority is always his patients.
True. By the way, it's my in-laws' anniversary today, which I've almost missed.
Oh, come, I'll drop you.
No, I've booked a cab.
Come on, let me drop you. You'll get late. And you said people are waiting for you. And the cab will take time.
Okay.
Come.
Sahari is my mom's surname. I use it so that I can still feel that she's there with me. She's dead. But she wouldn't have been if someone would have given her the right priority at that time.
Simran.
Excuse me.
We all are not same. And neither the Maker intended to do so. Then what is perfection? How do we define it? Still, we are all chasing perfection.
Partnered by time's influence.